Welcome to the Deep Dive. Today, we're getting into something really crucial in healthcare. Patient-reported outcome measures, or PROMs. Those scales where you, the patient, rate your own health, symptoms, how you're feeling. They're actually used all over the place.
Yeah, from screening right through to checking if a treatment is actually, well, doing anything. Super important stuff.
Absolutely.
Yeah.
And our mission today is to explore this fundamental debate about how these tools get made and checked. It's kind of a clash, really.
Right, between two big ideas,
Yeah.
psychometrics and clinimetrics.
Exactly. And we're going to unpack why one seems to be gaining traction and what that shift could mean for your care. Okay, let's get into it.
Sounds good.
So just to be clear, PROMs are basically self-report scales, right? Designed to capture your own experience.
Yeah, your subjective view, like how much pain are you really in? How's your quality of life? How is this condition affecting your day-to-day?
And they track changes, maybe after surgery or medication.
Precisely. And they can even help the conversation between you and your doctor. Make sure your priorities are clear.
Makes sense. So what's the traditional way these have been put together?
Well, the dominant approach for a long time has been psychometrics. It often came from outside medicine, actually more like education or psychology fields.
Okay.
And its big focus is on something called homogeneity of components. Basically, the idea is that every single question on the scale should measure the exact same thing.
Like tightly focused on one single attribute.
Exactly. And they should all be highly correlated. There are statistical tools, Cronbach's alpha is a famous one, to check this internal consistency.
And big systems like PROMIS or the Cosman guidelines, they follow this model.
Very much so. They're rooted in that psychometric tradition.
Okay, but you mentioned a debate. So this traditional way, it must have some downsides.
Yeah.
What are the critics saying?
Well, yeah, some argue that this intense focus on homogeneity can, and I quote, stifle the field. It might lead to scales that actually have poor performance in a real clinic because they might lack sensitivity. Think about it if every item is almost the same, just rephrased.
Like asking, how bad is your pain? 10 different ways.
Kind of, yeah. While that looks good, statistically very consistent, it might miss other crucial things. Like where the pain is, or what makes it worse, or how it stops you doing things.
Things a doctor really needs to know.
Exactly. So the argument is this redundancy, this statistical neatness, can ironically make the scale less sensitive to detecting real changes that matter to you or the clinician.
Right. So if psychometrics has these potential pitfalls for clinical use, what's the alternative?
The alternative framework is called clinimetrics. This term was really pushed by Alvin Feinstein, who called it the science of clinical measurements.
And how does it differ?
Well, crucially, clinimetrics does not insist on that strict homogeneity or measuring only one single dimension.
Okay. So what does it focus on then?
It focuses on the clinical utility. Does the scale actually work well in the clinic to assess complex things like symptom patterns, how severe an illness is, how it's progressing, or, importantly, treatment effects?
That sounds much more practical.
It's definitely geared towards practical application, and it highlights certain strengths. First off, sensitivity is absolutely key.
Sensitivity meaning?
Meaning its ability to tell patients apart from healthy people or distinguish between different patient groups. And critically, its power to reflect changes in experiments in therapeutics.
Like telling if a drug is actually working better than a placebo.
Precisely. If a trial shows no difference, the clinimetric view might ask, was it the drug, or was the scale just not sensitive enough to pick up the benefit?
That's a really important point. So it's about the measurement actually driving clinical insight.
You got it. And then there's validity, but viewed more broadly. Clinimetrics cares about clinical validity. Does it separate people with the condition from those without? And things like predictive validity, can the scale actually predict, say, how you might respond to a certain treatment?
And you mentioned incremental validity before. What's that about? Does every question need to add something new?
That's the idea. Each item, or even each whole scale, should give distinctive new information. Avoid redundancy, make every part count. And finally, there's clinical utility in a very practical sense. Things like sensibility. Is the PROM easy to use? Does it help the doctor-patient chat? Clinimetrics often favors shorter scales for this reason.
Easier to actually use in a busy clinic.
Right. And transferability. Does the scale work well across different types of patients or over long periods?
Okay, so pulling this together, what does this shift towards clinimetrics mean for patients and doctors?
Well, the argument is that choosing or developing a PROM should really lean on these clinimetric criteria. because they seem to align better with the messy, complex reality of clinical care.
It's not about throwing out old scales completely.
Not necessarily. If an existing psychometric scale happens to have good clinometric properties, if it's sensitive, valid in these ways, useful, then great. But the push is for new tools to be built and judged with these clinical principles front and center.
So looking at the bigger picture then.
It's really about moving beyond just statistical elegance,
Right.
ticking the boxes for internal consistency, towards creating tools that genuinely work and provide useful information in the real world of patient care, ultimately helping understand patients better and track outcomes more meaningfully.
That makes a lot of sense. So as a final thought for you, our listeners, to consider, think about how the way we measure something, a symptom, a feeling, an outcome, really shapes how we understand it and the care that follows. It begs the question, doesn't it? What other areas of measurement, maybe beyond healthcare, could benefit from this clinometric perspective? Focusing less on abstract perfection, perhaps, and more on practical, real-world usefulness. Something to think about.